Hi, Dr. Singletary. So today we're going to be talking about Campylobacter Coli. We're just going to have a conversation about it. Have you heard of that bacteria before?
I have heard of it. I don't know in detail a lot about it.
Okay. Do you know what type of infection it could cause in people or any symptoms?
I do not know.
Okay, so that is what we're here to explain to you today.
Okay.
So we're going to start off with a description of the bacteria itself.
Campylobacteria are gram-negative, S-shaped rods, and are microaerophobic, meaning they only require a small amount of oxygen to survive.
So on a stain, they will retain the gram-positive, they're gram-negative, sorry. They will retain the gram-negative stain, so we'll be able to see that they're gram-negative bacteria. Like she said, they are rods, so.
So the pathogen, hi, I'm new. The pathogen reservoir is generally found within the environment in mammals and birds. The common transmission is usually oral, and the bacteria is generally, even though that is transmitted orally, it's from the fecal-oral route, and not correctly prepared foods that are contaminated. So, like primarily poultry or anything, and contaminated water, drinking water.
Okay, so if you do get infected with E. coli, it usually causes some type of enteritis type infection, so you're going to be feeling a lot of nausea and diarrhea. But usually for healthy adults, we just don't treat it. It's self-limiting. We just, hydration, rest, and it'll resolve itself in a few days. But we do treat it in populations that are immunocompromised, the elderly, the children. So if it's treated, it's with antibiotics, and the first line antibiotic treatment is macrolides. However, there's a lot of resistance that's built up with macrolides. It's a huge issue with E. coli, so it's usually a very aggressive combo therapy with macrolides and fluoroquinolones. And so they're used aggressively to help prevent that resistance, but also treat the patient. And so macrolides work to kill the bacteria by inhibiting protein synthesis. And they do that by binding to the 50S subunit of bacteria ribosomes, and that helps prevent the bacteria to inhibit their protein synthesis so they can't replicate properly anymore. And then fluoroquinolones work against bacteria by binding to DNA and inhibiting DNA synthesis. So that's how they work.
Okay.
So then for adverse effects, we, just for the patient they have to be aware of is, so these are just some common adverse effects for macrolides. They're just going to cause some diarrhea, and that could, with that diarrhea, it's going to upset or disrupt that balance of that normal flora. So we have to keep that in mind. And then on top of that, it's going to cause nausea and vomiting. So that's just for the macrolides. So then for the fluoroquinolones, that's also going to exacerbate the nausea and vomiting as well. But then for severe adverse events, the macrolides, we have to be careful when we're treating a patient that might have any cardiac dysfunction, because that's actually going to increase the QT, can prolong that. So we have to be careful when we're dosing a patient for that. And then as well, it could also lead to torse de pointes, so funky rhythm of the heart. So those are for the macrolides, but then for the fluoroquinolones, we have to look at for adverse events, or for the severe adverse events, are going to be the neurological. So maybe memory impairment or delirium are going to be some of the side effects that they're going to experience. So it's not a good time.
Okay.
So prevention of the disease, to prevent it, proper food hygiene is most important. Eating well-cooked poultry and washing your hands to help prevent the spread of the infection.
That's all I can think of is the movie Contagion.
Yes, we do.
All right, do you have any questions for us?
No. It sounds like the treatment sometimes is as bad as the disease.
Yeah.
Which it can be. Like you say, the diarrhea is usually self-limiting.
Mm-hmm.
If you can support everything going on. But I'm just not familiar with the organism that much, just as a pharmacist, I'm looking at prevention and treatment.
Right.
Those are the things I'm
Right.
looking at. So it sounds like you're on target for treating it, what to do to support it until it gets better. What do you do if it doesn't get better?
That's a good question.
So if they don't actually see improvement in the patient, they actually look at to see how far this infection has spread. So that's going with like rectal endoscopies, just to see if it's gone through into the tissue itself, into the small intestine. And then they take further action from there.
Also treat the symptoms because you're gonna have like hyponatremia and stuff like that, just to get everything re-enriched at this point, or it's gonna keep on prolonging, or
Right.
you're just gonna die from dehydration.
Right.
That's definitely the biggest problem with dehydration.
Is that common around in the US or is it more in third world countries like?
Some of the things that I had read on it, a lot of people actually don't report it, statistically, yeah.
Don't know.
Yeah, they think it's just simple like food poisoning or something like that, so a lot of the cases, it's really hard to determine like the actual like percentage wise of the cases, so, because they just usually just don't say, hey, I have this, and they don't always follow up with it, so.
Yeah, I'm always on guard with natural products,
Yeah.
where they're using natural fertilizers and all that.
Right.
Where you really have to watch things very well. So you can see where that would prevent something like this from happening, so. Okay. I don't think I have any other questions. Thank you for the information.
Yeah, thank you for participating.
Okay, glad to do it.